Welcome to Tangled Routes, stories navigating youth and family systems. Brought to you by the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health. In this episode, we hear from Leroy, a passionate advocate from Texas who shares his journey of aging out of foster care, navigating college with mental health needs, and discovering the life-changing impact of people who chose to show up for him again and again.
My name is Leroy Soto, and I'm from South Texas. Aging out of the foster care system was when life started to hit me. It was then when I knew that I had to go to college and give it my all. There was nobody in my family with a degree. My family struggled financially. My mom was undocumented, and my dad just struggled getting a good job to provide for my family. Somebody had to be that difference, and I'm the second oldest of my siblings, so it was me who had to step it up and try to be that difference. I was going to be the first one in my family to go to college, or I was going to end up homeless and without anything. When I started the university, I struggled with multiple mental health issues like ADHD, depression, and anxiety. The first several years were tough because of that and added stress of having to go through the foster care system. I struggled building relationships as I struggled communicating with others and had trust issues that the system had instilled in me. When you're in the system, they always bounce you from home to home. You have caseworkers who change within a day, a week, sometimes a month, You have people that you start connecting to, and then they leave the agency, they move on, or whatever the case may be. And so then you have to just keep retelling your story, and it just causes more pain and trauma. Even them providing false promises like, oh, you're going to see your parents again, or you're going to see your siblings, or you're going home. And then that doesn't happen, right? And so that just creates a lot of anxiety, a lot of, just internal mental health issues with me. And it just me putting myself in a protective way where it's hard to trust somebody when you know they're going to be gone. There were also other people from Child Protective Services and other agencies who tried to keep me connected as well. There was one mentor that I still continue to talk to this day. She was my middle school and high school principal. She never gave up on me, and till this day acts like a mother. And I call her momager, like a mom who's a manager, because she will drive me to different events. She will give me rides to my medical appointments. She still joins me at my medical appointments because sometimes I struggle asking what I need. And she's known me so long that she's able to articulate my needs to my medical doctors. It took me 6 years to get my bachelor's degree, but who is counting? In order to stay in the dorms, and because I still didn't feel prepared to be on my own, I went for my master's degree in public affairs. It wasn't until when I was about to finish the program that I was told that my mother was deceased. Only God knows how, but I got my degree weeks later and dedicated to both of my parents who are now in heaven. After that, I went for another master's degree and still had my mentor who always taught me that life was a classroom and motivates me when I go down. I give her credit for where I am today because she's one of the person who has been very constant in my life. I mean, she knows so much about me. She hasn't given up on me despite me being myself, right? Just like a mother, right? She's just one of a kind. The advice I will give caseworkers or any child welfare practitioner in that case is to really look at young people more than just a case, even if they remove the youth or child from your caseload, try to keep that connection with them. Permanency connection or relation of permanency is very crucial in us thriving in life. If that caseworker is able to keep their relationship It's going to help that you feel that they have somebody they trust, somebody where they may feel safe, somebody where they don't have to reshare their story, and they can ultimately act as their advocate. So it's just trying to keep that connection with the young person. These people that I had in my life have helped me be who I am today, have not given up on me, and continue to inspire me to do good things in life despite the circumstances that I face. They celebrate me, they nurture me, and they continue to be the family that I always wish I had. I always try to give, when I think of giving myself credit, I don't think about it that way, just because I know that if I didn't have my village, I wouldn't be where I am today, especially struggling with mental health. I really do believe that it took my village to be able to be where I am. And of course, I did my parts too, and it's good, but, I think I need to give credit where it's due. For myself in the future, I still see myself working in the system, trying to make it better. I don't see myself ever leaving it. I try working somewhere else, but it's just a passion that I have, making it better, not just for young people, but also their families. What can we do to prevent them from entering the system, from them to having to go through trauma? That's my ultimate goal in life. And I think that I was called to serve and my calling. And so I will continue that until I can no longer do it.
Thank you for listening to Leroy's story on Tangled Routes, Stories Navigating Youth and Family Systems. Leroy's journey through foster care and mental health needs didn't end in defeat. It bloomed into connection, education, and advocacy. And at the center of it all, one adult who never gave up on him. His story is a powerful reminder that you don't need a fancy title or a perfect system to make a difference. You just need to show up again and again. And sometimes that's enough to change a life. To learn more about building authentic relationships and creating environments where youth can thrive, check out the resources in our show notes or visit the NTAC website. NTAC supports children, youth, and families living with mental health needs by promoting access to evidence-based and community-driven solutions. We create spaces for providers and leaders to learn, grow, and build a national support network. This podcast series was prepared for NTAC under a cooperative agreement from the U.S. Department of Health and Human Services, HHS. This event is supported by HHS as part of a Financial Assistance Award, SM-20-008, over 5 years, 2020 through 2025, and 100% funded by HHS. The contents and views shared during each session are those of the speaker or speakers and do not necessarily represent the official views of, nor an endorsement by, HHS or the U.S. government.